Hi, my name is Martha. I'm a registered nurse here at Hershey Medical Center, and I am a member of the Special Pathogens Unit, and I am currently been deployed to help take care of patients during the pandemic.
Martha, I understand you volunteered to work on this unit. Why?
I volunteered in that because I'm a little bit older than my peers. I'm 61, and I remember when AIDS and HIV came out, and that was a really difficult time for a lot of people. And one of the things that made it so difficult is we didn't know anything about it. And as they know me to say that fear is the mind killer and education is the cure. So let's find out about it. So I said we need to be involved.
Well, thank you for doing what you're doing. So you've now been treating patients that are COVID-19 positive for about 6 weeks. What have you learned about the virus?
This does not act like anything else that we've ever encountered. I've been a nurse for about 20 years. I've been with Hershey Medical Center for 18. I don't think we've ever seen anything like that, like this, that's moved so quickly, that has really demanded that we be thinking on our feet and trying to adapt to all the changes and things that we've learned along the way. I don't think anybody has, and I think that's what's taking everybody by surprise. We are developing evidence-based practice right now, so everything that we're doing now, it will impact what we do in the fall, because we anticipate this coming back. And we anticipate having to deal with this probably for the rest of our lives. So we're right in the middle of an experiment.
Hi, now we're here at the COVID unit here on the first floor of the Hershey Medical Center's emergency room. We have 12 beds, you can see them here.
The flow of patients, it waxes and wanes. Some days we have all 12 beds are full up, but it can change in a heartbeat. It truly can. So we have to be ready.
This is our cart that we keep all of our stuff in, all of our supplies. It's got gowns and gloves and more in it. And these are two of my co-workers here. This is Clarissa and this is Vianney. They're showing the new gowns the gown outfits that we have to wear. This is one with the N95 mask, and this is called the PAPR unit. So you get the unit, you get to wear the respiratory system that's appropriate for whatever task that you're doing.
We've been training, like I said, for the past 5 years, wearing this PPE, and it's a multiple layers of protection. And I'm used to it. We've been doing it. We've been practicing for this. And I think you have to be careful that you don't get too lax. So we watch each other, we encourage each other to make sure that you're putting the layers on properly, and more importantly, you're taking the layers off properly. I just shift my brain into patient care and focus on that, and just try to ignore any of the other discomforts that might come along. We have young adults all the way to very elderly that have been positive or that are concerning for it. Some people are very ill with high fevers on our unit. We've had a lot of respiratory discomfort and increased oxygen needs, and that's a little frightening for people. I can't breathe. So a lot of reassuring, using our audio system to call in, assure them that I'm watching you, it's okay. We're able to watch the monitors and say, don't worry, I'm watching you. A lot of reassuring going on. With COVID-19, because it's so contagious, we go in, we try to reduce the number of times that we go in, because that trip, not only is it exposing me to it, you to me, but also every time I go in, I have to use a whole set of PPE. So trying to also be diligent with our supplies, trying to make every time I open that plastic, take everything out of their wrapper, that it counts. We group care around mealtime. So I bring in your breakfast or your lunch or your dinner. I bring your medications that are due at that time, do vital signs. I'm in there for about anywhere from 30 minutes to some people, because they can't feed themselves, I'm in there for over an hour, and then I leave. And then you're by yourself for the next 3 to 4 hours until I come back in and start the process. It's a much, much different hospital experience. So it's a little frustrating for nursing, because it's not the kind of nursing that we've been doing, and it's not the kind of nursing that we want to do. We want to be able to spend extended periods of time with our patients. But this is the best way that we can do it right now.
Martha, you mentioned that you have asthma. You're 61. You are in this higher risk category. So why do this work?
I would be considered a risk patient, but I believe in the process. If I'm using my PPE, if we're following the protocols that we're supposed to be doing, then I feel very, very confident about it. I love my job, so it's not going to work for me. and to be with people, to educate people, to do the scientific stuff, to advocate for better patient outcomes. What an awesome job I have.